Welcome back. In today's Eye on Health, we're talking about breast implant illness. And joining us now is Dr. Danielle DeLuca-Pytell. First off, let's talk about what this is. I'm not familiar with this at all.
So breast implant illness is reported by a small minority of women that have breast implants, and it is a wide range of symptoms that can't be explained by any medical tests or any other diseases. So things like fatigue or joint pain or brain fog that women attribute to their implants because they can't find any other cause for it. And nobody else has been able to find a cause.
Okay, so how soon after an implant could you start to see some of these symptoms, or does it just depend?
It kind of depends. I will say that I typically hear people saying they were happy to get breast implants, and then some period of time later they started to notice things where they weren't feeling well, and they might have gone to see their physician and they couldn't find a reason for why they weren't feeling well. And when that happens, probably like you might do yourself, they hopped on Google and they may have then found breast implant illness and felt like, oh, now I found people that understand what I have. And what I want to talk about today was there's actually some really exciting, very good scientific research that is trying to help this group of women to not only treat them, but also help to guide what kind of treatments are best for these women so they don't fall into the hands of people who may not be as ethical about treating them.
Okay, and I would imagine that this could lead to obviously a lot of emotional issues outside of the physical, so it is important that you're going to the right people to get that help.
Sure, yes, it's not just the emotional issue. So I think there's been a whole lot of bad feelings about this, because I think a lot of women feel like they're not being heard because some people don't believe that this is an entity, because we don't have a way to diagnose it. And that was one of the things that this particular study looked for was, are there some sort of markers that we can draw blood for and say, oh, these numbers are high, this is breast implant illness. So it really is a diagnosis of exclusion. And unfortunately, there are also people who have heard about this and then they haven't gone to see their physicians. And we know that there are people who have been diagnosed with cancers because they just assumed it was this particular diagnosis, which again is of exclusion, so they couldn't find anything else, and then they had delay in diagnosis of something else. What was really great about this study is that it was blinded and prospective, meaning that there were two groups of people. They were able to be compared to each other. There was also a control group, and they followed them going forward as opposed to just looking backward. And what they found was that these women who reported this illness got better regardless of how their implants were removed. And in the social media world, there's a lot of talk about something called on-block capsulectomy. That refers to taking out the implant and all of the tissue that forms by the body around the implant. So there's a couple of problems. One, en bloc means cancer, and there's no cancer with this. But two, when you take out all of that scar tissue in people where the capsule is not problematic, you're exposing them to a lot of risk, a lot of lost time in work. It's a more expensive surgery. There's way more risk in having this operation, not just cosmetic, but people can have physical problems like decreased range of motion in their arms. They can have a collapsed lung. So it's not a little problem. And this study showed that as long as the implant comes out, it doesn't matter if a little bit of the capsule is taken or a lot of the capsule is taken, everybody has symptom improvement.
Okay, so definitely important to do your homework, go get seen if you need to, and have that conversation as soon as possible. Dr. DeLuca-Pytell, thank you again.
Thank you.